Okay. This is from question number 30, 2002 paper. True or false question. Paracetamol is recommended to be administered every 4 hourly for 48 hours to relieve fever in infants. That is false. They can give 4 hourly dose, not only for children, even for adults. But you have to be very careful about the number of doses and the total number of the paracetamol tablet you are going to take within 24 hours. The rule is that adults can take 2 500 milligram tablets 4 times a day, but they can keep 4 hours between doses. They can have 4 hours. 4 hours between doses, but maximum doses 4 per day. It is expressed as 16 milligram per kilogram body weight per day. Within a day, they can take for each dose 16 milligram per kilogram body weight, and for a day, so here it is dose. So when it comes to children, it is the same thing applies. So this is 15, not 16, 15 milligrams per kilogram body weight per dose, or 60 milligram per kilogram body weight per dose. So if the patient is say 70 kilogram weight, 70 kg patient to take how much in one dose? 16 milligrams per kilogram. So kilogram cancels. So it is 15 now, 15 milligram. 15 milligram into 7, 1050 milligrams per dose. For 70 kilogram adult, that comes to 500 milligram tablets. So adults can take 2 tablets a day, and for children, it depends on the body weight. You can adjust the dose. And even for children, in bit, they can take 60 milligram per kilogram body weight per day, but it should be only 4 doses. If necessary, they can have 4 doses within 24 hours. If they want, they can give say one first dose at 8 o'clock. They can give the second dose at 12 o'clock in the date after 4 hours. Number of doses will be only 4. P. Aspirin is used in high dose to prevent clot formation in arteries. Aspirin is given to prevent clot formation. Aspirin prevents clot formation in arteries, but it is not in high doses, it is low doses. 75 milligram or 100 milligram we give. Question C, part C. Paracetamol overdoses treated with N-acetylcysteine. That is true. there is a product called NAPQI. NAPQI is a product coming from the liver. This is toxic to liver product, liver cells. So NAPQI under normal dose it produced but immediately removed by the liver. But when it comes in high doses, high quantity, that means paracetamol overdose. So this compound will be accumulated and it will be toxic to the liver cells. So this is N-acetyl para-immunoquinine, immunoquinine imine. So NAPQI, they exam also they don't give the full name, they give as NAPQI. N-acetyl para-immunoquinine. E. So the treatment is N-acetyl cysteine. N-acetyl cysteine. Cysteine is an amino acid, so give N-acetyl cysteine to produce more glutathione in the body. Glutathione actually remove this. More glutathione is produced in the body by the liver when they give N-acetyl cysteine, that is given in intravenous infusion. Diclofenac sodium is registered for use and antiepileptic, antipyretic in children. So, that is false, they can't give. That is not allowed. This drug is registered, not registered to give for children. Ibuprofen does not cause gastrointestinal bleeding, that is false. Ibuprofen is an NSAID, non-steroidal anti-inflammatory drug. So it will cause, as any other NSAID, it will cause gastric ulcers, gastric bleeding. So the next one is true or false about beta blockers. What are beta blockers? Beta blockers block beta receptors. Beta blockers block beta receptors. Beta receptors are in beta 1 in heart and beta 2 is in lungs. So two types of beta receptors, beta 1 in heart, beta 2 in lungs. So if any drug is blocking this receptor is a protein on cells. So when it is stimulated by noradrenaline or adrenaline, so that is sympathetic stimulation. So say this is the beta receptor here, and beta blocker, beta stimulant come and stimulate. Stimulant stimulate. When you use a beta blocker is different. It will come and block you. So the no adrenaline or adrenaline cannot come here because it is blocked by our drug. So these receptors are in millions in our organs. like heart and lungs. So in the heart it is beta 1. So propranolol is non-selective beta receptor blocking agent. That means propranolol blocks beta 1 and beta 2 both. Beta 1 block करना, beta 2 block करना, non-selective के. समहार कोई beta block करना. समहार ये selective beta blockers. Selective beta blockers වැඩිපුර block කරන්නේ beta 1. beta 1 100 times 100 block කරනකොට beta 2 102 block කරන්නේ. එතකොට beta 1 selective එක. ඒ beta 2 වලට effect එකක් තියෙනවා පොඩි. So beta 1, when you block beta 1, what happens? The receptors are stimulating the heart rate and force. So when it is blocked, the force of heart beat is going down, slowing. That means the pressure will go down. Now, propranolol is an example for non-selective beta blocker. It blocks beta 1, it blocks beta 2, both. So, if in an asthma patient take propranolol, what happens is that now propranolol will block beta 1 and beta 2. Beta 2 is in lungs. What happens is patient get worse. Asthma, what do you know? Wheezing, what do you know? Increase the wheezing. So that is beta 2 blockers also they block. So it causes bronchoconstriction, means the airways are constricted, smaller. So heart, what happens to the heart? Heart rate will go down, heart contractility, force of contraction will go down and blood pressure will go down. So another thing happens, in blood vessels you get something called alpha receptors. Alpha 1 receptors are in the blood vessels. So alpha 1 receptors are also blocked, affected by propranolol to a certain extent. So alpha 1 receptors will be constricted. So again, vascular smooth muscle contraction by alpha 1, that also will be reduced by beta blockers. Reduced by alpha blockers. That is different. Propranolol reduce the release of alpha epinephrine and norepinephrine. Blockers, they reduce the effect of epinephrine and norepinephrine. They are neurotransmitters. Here it is the same thing I have told. Propranolol is used for migraine attacks, and when the patient get thyrotoxicosis, that is high T4 levels, patient will go to emergency situation, start shivering. So propranolol is the drug to give. Okay. Now when they take beta blockers, pharmacists should always know certain things. Beta blockers are given for hypertension. So say within the heart, it has say 100,000 beta 1 receptors. Patients start with beta blockers. Now receptors are there, but they are not all. So some of the this is the receptor is blocked by the drug. So what the organ identifies not enough beta receptors. Heart එකට තේරෙනවා මදි beta receptors කියලා. හදන්න පටන් ගන්නවා අලුතෙන්. ටික ටික හදනවා. ආයකට කියනවා upregulation, that is called upregulation. Upregulation කියන්නේ මේ වැඩි කරනවා. දැන් අපි මේකට එකතු කරා තව අලුතෙන් හැදෙනවා 30,000. Then patient තියෙනවා 130,000 receptors, but most of them are blocked, so all are not in function. The patient take beta blockers for say 1 year, and suddenly if the doctor change the drug, go to calcium channel blocker, stop the drug, what will happen? Now if the patient stop the drug today, from tomorrow these 130,000, the whole number of receptors are now open, but it need only 100,000. Now more receptors are active, more stimulation, the patient's blood pressure will shoot up, immediately go up, and maybe even patient can die. So if the patient is coming to you with the prescription, you have to ask about the previous ones. And if a patient coming to the pharmacy with atenolol prescription, and suddenly if the patient comes with another kind of antihypertensive drug, then ask the patient or call the doctor and say it is dangerous to stop it suddenly. It has to be gradual change. So keep on, if the patient is on 100 milligram atenolol, 100 milligram, then 1 week change it to 50 milligram, and the new drug also small amount here, and go on. The next week can take 25 milligram atenolol and the new drug more. So it is, the patient has to gradually increase change to the new drug. Patient can get severe chest pain, heart attack, and very high blood pressure if not. Diabetic patients, beta blockers, you have to know this. If the patient is diabetic, what happens? Patient can become hypoglycemic when they take sulfonylurea, so insulin, they can get suddenly hypoglycemia. So patient knows it because patient gets headache and giddiness and sometimes shivering. So then only patient knows that patient is going to be hypoglycemic and continue it without taking any steps to reduce that, patient will go to coma. If the patient is on beta blockers will mask the symptoms of hypoglycemia. Then the final result is worse because patient can go to coma suddenly. So educate the patient. Or normally doctors don't give atenolol for diabetic, uncontrolled diabetic patients. Then asthma patients cannot take atenolol or beta blockers, and atenolol and beta blockers can cause cold extremities because the heart force is slow now, heart rate is slow, not enough blood coming to peripheries on the skin, and also patient can go to cold hands. So asthma patients warning. These are the ones. D. Their use is associated with tachycardia. Beta blockers cause bradycardia, slow down the heart rate, reduce the heart rate. True or false of diuretics? Fusimide is considered as a potassium conserving diuretic. It is a potassium losing diuretic. High efficacy diuretic, it will lose potassium in our body. Fusimide is effective in treating acute heart failure. That is true. Not only fusimide, these are the other drugs used in acute heart failure: ACE inhibitors, ARBs, angiotensin 2 receptor blockers or beta blockers, mineralocorticoid receptor antagonists. That means that is amyloid and or potassium sparing drugs, spironolactone. Then diuretics they can take hydroxyzine, nitrate, and digoxin. See, thiazide diuretics should not be prescribed in hypertension. It is false. Thiazide diuretics are the drug that is used in first stage of hypertension. Spironolactone is a high efficacy diuretic. That is a low efficacy diuretic because it conserves only very little sodium. It prevents absorption of very small sodium. As a diuretic, it is not effective. Amyloid is a loop diuretic. Amyloid, no, it is potassium sparing diuretic. True or false of drug side effects combination. Sodium valproate weight loss. It is actually cause weight gain. But what do you know? Common side effects of sodium valproate: stomach pain, diarrhea, dry or sore mouth. So these are the side effects. It is used to treat epilepsy and bipolar disorders. Brain. Metoclopramide, abnormal movement of the neck and face. That is true. You get sometimes Parkinson-like symptoms. Side effects include drowsiness, dizziness, tiredness, trouble sleeping, agitation. So have a look. Remember, at least it's common side effects in psychiatric drugs. Bisocodile post constipation, that is false. Bisocodile is given for constipation. It is a stimulant laxative. E. Pilocarpine eye drops given for dilated pupil. That pilocarpine actually constrict the pupil, make it smaller. That was used before when ladies, before going to parties, they add some pilocarpine, that is from the plant Pilocarpus jaborandi, to the eyes. Then eye pupil become very tiny. Pilocarpine works by causing pupil of the eye to shrink. Okay, then go to 34. The following drugs should not be used during pregnancy. Tetracycline. Out of antibiotics, you can use penicillin group, cephalexin group safely. All others have side effects. So prednisolone you can give, no problem. C. Ofloxacin, that cannot be given. It is a quinolone antibacterial drug that That is toxic, teratogenic. Enalapril is not allowed in hypertension for pregnancy people, and primaquine also not given. Primaquine is the anti-malarial drug. If the patient gets malaria infection, they can be treated with chloroquine. And after the delivery, they have to give primaquine because in the liver, malarial parasite can stay without causing the disease for sometimes some years and later come out and start the disease. So they have to give both primaquine and chloroquine. Chloroquine kills the blood parasites, malarial parasites living in red cells. They are killed. But chloroquine cannot kill the liver stage of the parasite. So they have to take primaquine, but not during pregnancy. Okay. Thank you.